Vietnam's healthcare system is expanding rapidly, driven by strong economic growth and rising demand for modern medical services. For foreign investors, establishing a general hospital in Vietnam offers both long-term business potential and social impact. However, the healthcare sector is highly regulated, requiring strict compliance with the Ministry of Health's licensing, facility, and staffing standards. Under Vietnam's WTO commitments, CPC 9311 hospital services, foreign investors are permitted to establish 100% foreign-owned hospitals or form joint ventures with Vietnamese partners. Healthcare is a conditional business sector. Investors must comply with investment licensing under the Law on Investment and meet all medical licensing requirements regulated by the Ministry of Health, MOH, before operation. The first step is to obtain an Investment Registration Certificate, IRC, and an Enterprise Registration Certificate, ERC, from the Department of Finance, DOF. The IRC confirms your legal right to invest in healthcare services in Vietnam, while the ERC establishes your company as a legal entity and defines its business lines as medical examination and treatment services. After receiving these two certificates, investors must complete post-licensing tasks such as making the company seal, opening a corporate bank account, and contributing charter capital within 90 days. Under Vietnam's international commitments, the minimum investment capital for establishing a general hospital is $20 million US. This capital ensures adequate resources for infrastructure, high-standard medical equipment, and qualified medical personnel. Depending on the hospital's scale and specialization, higher investment may be required to meet Ministry of Health technical standards. At LTS Law, we assist investors in developing an optimal capital structure that aligns with both legal requirements and long-term business goals. General hospitals must strictly comply with the Ministry of Health's regulations on infrastructure and technical standards. A general hospital must have at least 50 inpatient beds, emergency and intensive care units, operating rooms, outpatient departments, sterilization areas, and diagnostic units such as imaging and laboratory facilities. Each area must meet safety, hygiene, and design standards consistent with Vietnamese health regulations. The hospital must also be equipped with modern medical devices suitable for comprehensive patient care, emergency response, and infection control. Every hospital must appoint a medical director who is a licensed Vietnamese doctor with at least 9 years of medical experience and has professional qualifications appropriate to the hospital's specialties. All practicing doctors, nurses, and technicians must hold valid Vietnamese practice licenses issued under the Law on Medical Examination and Treatment. Foreign doctors may work at the hospital, but their qualifications must be recognized and converted into Vietnamese medical licenses before official employment. They must also demonstrate adequate Vietnamese language proficiency or work under translation support in clinical settings. Beyond company registration, every hospital must obtain a medical examination and treatment operating license issued by the Ministry of Health. This license certifies that the hospital meets all legal requirements on capital, infrastructure, equipment, and qualified staff before commencing operations. Without this license, the hospital cannot legally provide medical services in Vietnam. A general hospital must provide multiple core specialties, such as internal medicine, surgery, pediatrics, obstetrics and gynecology, and emergency medicine. Each department must be managed by a specialist doctor with a valid practicing certificate and adequate years of experience in their respective fields. Depending on the hospital's scale, additional departments such as cardiology, neurology, dermatology, or oncology may be added, subject to Ministry of Health approval. Hospitals are required to comply with fire prevention, environmental safety, and medical waste management regulations. They must obtain fire safety certification, ensure proper treatment of medical waste, and maintain separate areas for sterilization and contaminated materials. Additionally, hospitals must protect patient information and medical records in accordance with Vietnam's laws on data protection and confidentiality in healthcare. All hospitals are subject to regular inspections by the Ministry of Health and provincial departments of health. Inspections focus on quality of care, infection control, patient safety, and compliance with medical licensing conditions. Hospitals must also submit annual operational reports and maintain internal systems for self-assessment of healthcare quality, as required by the Law on Medical Examination and Treatment. Violations such as operating without a license, employing unlicensed staff, or failing to meet technical standards may result in fines, suspension, or license revocation. At LTS Law, we provide comprehensive legal assistance for foreign investors establishing hospitals in Vietnam. Our support covers every stage of the process, from preparing and obtaining the IRC and ERC, structuring capital and investment feasibility documentation, and advising on hospital land lease and construction compliance, to preparing and submitting the complete medical operating license dossier to the Ministry of Health. We also assist in staff licensing and the recognition of foreign medical qualifications. With our bilingual legal and healthcare compliance team, your hospital project will be established efficiently, legally, and ready for long-term success. Don't let complex healthcare regulations delay your investment in Vietnam's growing medical sector. Contact LTS Law today or visit lts.com.vn for a free consultation. Your general hospital will be established legally, smoothly, and ready to deliver world-class healthcare to patients across Vietnam.